Hello, I'm Eric Bowen. I'm one of the staff cardiologists at National Park Medical Center. Cardiac catheterization or angiogram is a procedure we perform routinely to access the central circulation to take pictures of the coronary arteries to determine if there's blockage in these arteries or not. Typically, an angiogram is performed if a patient has symptoms that are suggestive of angina or heart pain, or if they've had a stress test that looks abnormal, again suggesting they may have blockages. Typically during the angiogram, the patient has what we call a twilight sedation. We give sedation to make them sleepy, but they're still very arousable. They're breathing on their own. They're not on breathing machines. And this allows us to do the arteriogram with the patient being comfortable. Typically, the patient should not feel anything during the arteriogram. Typically, the patients will be under a light sleep, but be easily arousable during the case. A stent is typically placed if a person has a blockage of 70% or greater, or if there's a major part of the circulation that may be compromised by not fixing the artery. Typically with the angiogram, sometimes we go into the wrist artery, sometimes we go into the femoral artery and the groin crease. The restrictions are different depending on what the access is, but for the most part, patients need to not do much physical activity for a day or two to prevent any bleeding from the access sites. Typically, some patients may feel a little bit tired after the procedure because we do give medicines for sedation, but typically these are worn off within 24 hours. Typically, if patients were continuing to have their presenting symptoms such as shortness of breath, chest discomfort, anything unusual after the arteriogram, they should see their cardiologist. So not everyone who has a cardiac catheterization will require a stent. Sometimes the cardiac catheterization may be totally normal. Sometimes a person may have mild blockage that we may treat medically. Some patients may require stenting because they have a focal blockage. And some patients may have multiple blockages which may benefit better for them to have bypass surgery.